Aren't you glad that we're going home today?
Good afternoon, Mr. Kim and
Christine.
Okay, Mr. Kim and Christine, I'm your nurse Angeli, and this is
Henrietta, I'm your other nurse.
correct. And we understand that you're going to be going home pretty soon. That's right.
Yeah, today.
Correct. Okay, so you're going to be taking care of the G tube at home, correct? So once you're home, I know you can have gloves, but if you don't have any gloves, make sure you do hand washing.
Okay.
Correct. So when you're home, make sure you have a measuring cup and a syringe. We'll provide you the syringe. We want to check for placement first, and the first thing you want to do is, may I see your tube, please, Mr. Kim? Thank you. You see how it's clamped over here?
Yeah.
This is clamped in order to prevent the fluids to coming back up up the tube. So we want to unclamp it first. Okay, you see how it's unclamped. We put the syringe. You want to withdraw. You're gonna see yellow, like a yellowish fluid. That's stomach content. If you want to withdraw, and if you see that it's more than 100 mLs, you see how 100 mLs. You see if it's more than 100 mLs, you want to push this back inside your stomach, because this is nutrients that your body needs. So we don't want to get rid of that. Slowly you do it. You push it back slowly, and then you pour it back with water. Okay, you have to flush it with water.
How much water should
50 mLs of water,
Okay.
ma'am. Yeah, 50 mLs. So in case, let's say it's less than 100 mLs, that means you're ready to feed. So before any feeding, you want to flush it with 50 mLs of water. Okay. So we have the syringe. What we want to do is take this out. Okay. So we put it in, and then that's why you need the measuring cup. You put in 50 mLs of water. You let it go with gravity, holding this up tight, so the water goes through, and then you're ready to do the feeding. Okay. And after the feeding is done, you put in another 50 mLs. You flush it with another 50 mLs of water.
Okay.
Okay. So this is done. We can take this out. Make sure you clean this. And lastly, you want to make sure this is clamped again. Okay.
Okay.
Because if you don't clamp it, then everything's gonna come right out. All right. So that's that. And then I know you're going home with a few medications, correct? The Colace, it's liquid form, so that's perfectly fine. You don't have to. It's not a pill, so it's gonna be administered through the tube.
Okay.
Same thing. You have to make sure you check placement, and then flush it before and after.
Okay.
Okay. So and also you're going home with a CPAC, correct? An
What is
antibiotic.
that? Okay. Yeah.
Antibiotic to prevent any infections. So for that's a pill. So what you're gonna have to do is make sure you put it into a plastic bag and you crush really well.
Okay.
Once you get those particles, you're going to put them in filter water, and then once those particles melt, you're gonna pour it back. You're gonna pour it in the tube the way I show you with the tube feeding.
Okay.
Okay. Before and after, you always flush. You don't forget that. Okay.
Okay.
And something really important is that before you do any feeding, you want to make sure he's sitting upright in order to prevent any choking or aspirations.
Okay.
Okay? Alright, Mr. Kim. So now I'm done with my teaching. Your second nurse, Henrietta, she's going to come in and teach you on further information.
Thank
further
you,
information.
Anyely.
Thank you.
Clap along if you feel